Hi viewers, in this video we are going to discuss about dog bite. My name is K. Priyadarshini, working as a lecturer in Madras Medical Mission College of Nursing. Objectives of this video. At the end of the section, the viewers are able to define what is dog bite and enlarge what are the first aid measures for the dog bite. Explain the treatment for dog bite. We will see what is dog bite. Dog bite is a bite upon a person or other animal by a dog. More than one successive bite, we often called as a dog attack. Okay. Although dog attack can include knockdowns and scratches, some dog bites do not result in injury. They can result in infection, disfigurement, temporary or permanent disability, or even death also. So, what is dog bite? Bite upon a person or other animal by a dog. We call this dog bite. More than one successive bite, we use it to term as dog attack. Okay, what is the first aid measures for dog bite? Immediately wash the wound thoroughly with soap and water for full 5 minutes. Okay, and apply pressure to stop bleeding with a clean cloth. Use an antibiotic ointment, cover with a sterile bandage, and see a doctor for a deep wounds, heavy bleeding or signs of infection, redness, swelling, pus, and to check for rabies and tetanus risk, especially if the dog status is unknown. What are all the first aid measures? We have to wash the wound immediately after the bite thoroughly with soap and water for 5 minutes. Apply pressure to stop bleeding if bleeding is there with a clean cloth. Use an antibiotic ointment. Cover with a sterile bandage. See a doctor for deep wound, heavy bleeding, signs of infection. Check for rabies or tetanus risk. Especially we have to give attention more if the dog status is unknown. Categories of bite sound. Usually bite wounds fall into 3 categories. Category 1, no impact on skin and the skin remains unbroken. No impact on the skin and skin remains unbroken. For example, petting an animal or providing it with food. Legs also falls under this category. Category 2, small scrapes but absence of bleeding. That we termed as category 2. Last one, category 3, one or more bites which puncture the skin with the animal saliva entering the wound. So 3 categories totally bites under category 1, no impact on the skin. Skin remains unbroken. Category 2, small scrapes but absence of bleeding. Category 3, one or more bites which puncture the skin and animal saliva entering into the wound. When to see a doctors? Within 24 hours, we have to see the doctors. What are the conditions? The bite is deep, gapping is there in the skin, or bite on the face, hands, or joint. Bleeding won't stop. You see the signs of infection. Examples: increased redness, swelling, warmth, pus, or red streaks. The dog rabies vaccination status is unknown and it seems aggressive and sick. The dog seems to be aggressive and sick. Sick. You have not had a tetanus shot in the last 5 years. In these are all the conditions, we have to consult the doctor within 24 hours. Antibiotics commonly used for dog bites or bite related wound. Amoxicillin, clavulanic, ampicillin sulbactam, trimethoprim, and sulfamethoxazole, clindamycin, erythromycin, ceftriaxone, tetracycline. These are all the antibiotics commonly we use it for bite-related wound. Vaccines and immunoglobulins, tetanus toxoid, rabies vaccine, rabies immunoglobulin. These three vaccines we usually recommend for a person suffering with dog bite. Post-exposure prophylaxis for rabies and the tetanus. If the patient has received fewer than 3 doses of tetanus vaccine or the patient vaccine status about tetanus is unknown, tetanus immunoglobulin and 1 vaccine dose should be administered. If the biting animal presents any abnormal behavior such as hypersalivation, seizures, paralysis, irritability, in that case, rabies immunoglobulin should be administered to the patient, as well as rabies vaccine doses on the days 0, 3rd day and 7th day and 14th day of post-exposure. We usually to recommend the rabies vaccine. If the patient was previously vaccinated, means vaccinated less than 5 years, vaccine doses on the day 0 and 3 alone is sufficient for those clients. Next, where to vaccinate? The anti-rabies vaccines and rabies immunoglobulin are provided free of cost in public health facilities across the India, including government hospital, medical colleges, and designated anti-rabies clinics under the National Health Mission and National Free Drug Initiative Program. The government funds the procurement and distribution, ensuring life-saving treatment is accessible for animal bite victims. So, anti-rabies vaccine is available in all government hospitals, including primary healthcare centers. Standard post-exposure prophylaxis schedule for dog bite. 0 day first vaccine dose plus rabies immunoglobulin infiltration around the wound and the IM. Day 3 second vaccine dose. Day 7 third vaccine dose. Day 14 fourth vaccine dose. Day 28 fifth vaccine dose. If you have been vaccinated before, if the vaccinated within last 5 years, 2 doses. Day 0 and day 3 are often given with no rabies immunoglobulin. If vaccinated between 5 to 10 years, 2 doses may be needed. If vaccinated over 10 years ago, a full 5 dose course might be recommended for the victims. Till now, we have discussed about what is dog bite, what are all the categories of bite-related wound, and what are all the first aid measures, how to take care, vaccines available for dog bite, and where we have to get those vaccines, all those things. I hope that you're able to understand what is dog bite and what are all the first aid measures we should take for dog bite clients. Thank you viewers for your support.